Hi, I'm a Psych NP, and I have some practice questions for you on dementia to help you get an A on your upcoming test. Ready? Let's learn Psych fast. Question 1. Depression is comorbid in up to blank of people with Alzheimer's disease or dementia. Is the blank A, 10%, B, 50%, or C, 75%? Answer B, 50%. Depression among older adults with dementia occurs up to 50% of the time and may represent a comorbid illness or neuropsychiatric symptom of dementia. So it's important to identify and treat the depression as it will result in improved quality of life. Question 2. An 84-year-old widow living alone is independent in her ADLs and most of her IADLs. Meds are hydrochlorothiazide for hypertension, tolterodine for incontinence, escitalopram for dementia, acetaminophen is PRN. It also takes calcium, vitamin D for osteoporosis prevention. Her MMSE is 23 out of 30. On exam, you'd note no cogwheel rigidity or tremor. Which change is indicated? A. Add Donepezil 5 mg daily. B. Discontinue tolterodine and reassess. C. Add vitamin B12 100 mic injection monthly, or switch to the hydrochlorothiazide to lisinopril 5 mg daily. Answer B. You want to discontinue the tolterodine and then reassess. Why? Well, tolterodine is an anticholinergic and it's listed on the Bayer's criteria. As with age, one becomes more sensitive to its adverse cognitive and psychiatric effects. These anticholinergics can lead to higher risk of cognitive decline in people with dementia, causing non-reversible brain atrophy. It can also reduce kidney function, causing the medication to build up further in the body, causing even more side effects. Question 3. An 87-year-old man with Alzheimer's disease is receiving Rivastigmine 6 mg BID. His family notes improvement, but he's been experiencing nausea and vomiting related to the Rivastigmine. Which recommendation is the best? A. Advise the patient to take his drug with an antacid. B. Change the Rivastigmine to daily patch that delivers 9.5 mg per day. C. DC the med and initiate memantine 5 mg BID. Or should we add prochlorobenzene 25 mg rectally with each dose of Rivastigmine? Answer B. You want to change the Rivastigmine to a daily patch that delivers 9.5 mg per day. Well, so why is that? So it's because that medication is a potent inhibitor of acetyl and butyryl cholinesterase. Thus, it causes a cholinergic effect like nausea, vomiting, and diarrhea. To reduce these effects, switching to a transdermal patch is advised to lessen the incidence of cholinergic adverse effects. Since the maintenance dose of 12 mg per day has already been achieved, the patient can change directly to a patch. Antacids will not decrease the GI effect much, and prochlorperazine itself is an anticholinergic. Rivastigmine appears to be working, so we don't want to discontinue it at this stage. Question 4. A 75-year-old woman with Alzheimer's disease is treated with Donepezil 10 mg daily for 3 years. Her MMSE has decreased from 21 to 17 out of 30. She cannot do her IADLs, but she can do ADLs with queuing. She could not tolerate Donepezil 23 mg. Which is the best course of action to take? A. Retry Donepezil 23 mg daily. B. Initiate memantine 5 mg daily. C. Add vitamin E 400 units twice daily. Or D. Should we switch to Donepezil to Rivastigmine 9.5 mg patch daily? Answer is B. You want to initiate memantine 5 mg daily. A nice slow decline has occurred over the past 3 years, so the medication is working. So we keep her on the Donepezil same dose since she did not tolerate a higher dose in the past. Switching to another cholinesterase inhibitor is incorrect. Memantine is for moderate to severe AD. Vitamin E has not been shown to be effective in most large prospective trials. Question 5. A patient diagnosed with moderate dementia consistently appears to be distorting the truth, resulting in his wife asking, "What should I do when he lies to me about unimportant things?" Upon what rationale should your response be based? A. Changing the topic provides diversion. B. Delusions should be confronted to clarify thinking. C. Ignoring memory deficits avoids catastrophic reactions. Or D. This isn't lying, but rather a way to fill in the memory gaps. The answer is D. This isn't lying, but rather a way to fill in memory gaps. Confabulation is not lying, but rather a method for filling in the memory gaps. Ignoring, using confrontation, and changing topic should not be useful as gently reorienting. Question 7. A patient diagnosed with Alzheimer's disease has a catastrophic reaction during an activity involving simultaneously playing of music and working on a craft project. The patient starts shouting, "No, no, no," and rushes out the room. What should you do? A. Discontinue the activity program since it upsets the patients. B. Follow the patient, reassure her, and redirect her to a quieter activity. C. Isolate the patient until she is calm and then direct her back to the activity. Or D. Give the patient a PRN anti-anxiety medication and restrict her activity and participation. The answer is B. You want to follow that patient, reassure her, and redirect her to a quieter activity. These actions will restore safety and self-esteem. Isolation will decrease self-esteem and may increase confusion. It's only one patient that is distressed, not the entire group. Behavioral intervention should be attempted prior to administering medication. Question 7. An elderly patient was well until 12 hours ago when she reported to her family that in the middle of the night she awakened to see a man standing at the foot of her bed. There's no evidence that this situation ever happened. This series of events supports which possible diagnosis? A. Delirium, B. Anxiety, C. Paranoia, or D. Dementia? The answer is A. Delirium. Delirium is a disturbance of consciousness and cognition that develops over a short period of time. It is secondary to a medical condition. The scenario does not fit the disorders mentioned in the remaining options. Question 8. Which situation would be most likely to serve as a trigger to a catastrophic reaction to a patient with stage 2 Alzheimer's disease? A. Participate in singing happy birthday to another patient at dinner. B. Being scolded by an aide for spilling a glass of milk. C. Listen to the big band music from the 1940s. Or D. Eating cupcakes in the activity room. The answer is B. Being scolded by an aide for spilling a glass of milk. Catastrophic reactions are over-exaggerated negative emotions responses initiated as a result of a perceived failure at a task or change in the environment. Being scolded by the aide presents a situation that would clearly be frustrating to the patient. Question 9. Which theory of etiology of Alzheimer's disease suggested by current research might you use to help the family understand that this disorder is not a psychosocial origin? Alzheimer's disease is associated with what? A. Abnormal serotonin reuptake. B. Prior infection of the gray matter. C. Amyloid protein deposits in the brain. Or D. Excessive acetylcholine in the frontal cortex. It's C, those amyloid protein deposits in the brain. The prevalent theories of etiology of Alzheimer's disease include the following: angiopathy and blood-brain barrier incompetence, neurotransmitters and receptors deficiencies of acetylcholine, abnormal proteins, specifically amyloid and their proteins, and genetic defects. Neither serotonin nor prions are implicated as problems in Alzheimer's disease. Question 10. A patient may have a blank thiamine or folate deficiency, which can present with cognitive change. Is it the blank iron, vitamin B12, or vitamin A? The answer is B, vitamin B12. Having deficiency of vitamin B12, thiamine, or folate can present with cognitive changes, also known as reversible dementias. Question 12. Memory loss or forgetfulness is a non-pathological as long as the item or memory is recalled within blank number of hours. Is that blank 6 to 12, B 12 to 24 hours, or C 24 to 48 hours? The answer is C, 24 to 48 hours. Forgetfulness is a characteristic of normal aging, such as when the person displaces an object or has short-term lapse. So this is not pathological, as long as the item or memory is recalled within 24 to 48 hours. Question 12. A higher risk of dementia was associated with depressive symptoms during blank. What's the blank? A, midlife, B, late life, or C, A and B, midlife and late life? The answer is B, late life. In an article published online in JAMA Psychiatry, a study of men and women found that depressive symptoms in late life, but not midlife, were associated with a higher risk for dementia. Question 13. Which of the following conditions affects memory and other cognition functions, typically that does not affect daily functioning and may lead to dementia within 3 years? A, age-associated memory impairment, B, depression, C, mild cognitive impairment, or D, subjective cognitive decline? The answer is C, mild cognitive impairment. Mild cognitive impairment, also called MCI, affects memory much like dementia, but it typically does not affect daily function. Up to 50% of patients with MCI develop dementia within 3 years. So choice A, age-associated memory impairment, refers to change in cognition that occurs with aging. This condition does not affect daily functioning and does not indicate dementia. Choice B, that's depression, and that may mimic dementia and also may be the first manifestation of dementia. Choice D is subjective cognitive decline, is indicative by a self-experienced persistent decline in cognitive capacity, but normal performance on standardized cognitive tests. Question 15. True or false, research believes plaques in the brain and tangles of the neurons are the main reasons for causes of Alzheimer's disease. True or false? The answer is true. So researchers have focused the role of two proteins as the cause of Alzheimer's disease, plaques and tangles. So plaques, those are beta amyloid. It's a fragment of a large protein. When these fragments clump together, they appear to have a toxic effect on the neurons and disrupt communication between brain cells. These clumps form larger deposits called amyloid plaques, which also can include other cellular debris. Tangles, which are tau proteins, play a part in the brain cell's internal support and transport systems to carry nutrients and other essential materials. In Alzheimer's disease, tau proteins change shape and organize into structures called neurofibrillae tangles. The tangles disrupt the transport system and cause damage to cells. Question 16. Which of the following are considered cholinesterase inhibitors? A, Donepezil, B, galantamine, C, Rivastigmine, or D, all of the above? Answer, D, all of the above. So people with Alzheimer's disease have reduced levels of acetylcholine in the brain. Cholinesterase inhibitors have been shown to have modest effect on dementia symptoms such as cognition. These inhibitors work by blocking the action of the enzyme cholinesterase, which is responsible for the breakdown of acetylcholine. This increases the levels of acetylcholine in this synaptic cleft. Question 17. There is convincing evidence of improved function and across-the-board cognitive benefit for patients with vascular cognitive impairment using which cholinesterase inhibitor? A, Donepezil only, B, galantamine only, C, Rivastigmine only, or D, Donepezil, galantamine, and Rivastigmine, or is it E, neither of these three meds? Answer, D, using Donepezil, galantamine, and Rivastigmine. All three of these drugs are found to be helpful, but research has shown that Donepezil 10 mg is to be ranked first in terms of benefit, but third in terms of harm. Galantamine was ranked second in terms of both benefit and harm, and Rivastigmine, it was ranked the lowest of the cholinesterase inhibitors in both benefit and harm. Question 18. When medication is needed for the management of hallucinations and agitation in Lewy body dementia, which type should be tried first? A. Atypical neuroleptics, B. Cholinesterase inhibitors, C. Anti-epileptic drugs, or D. SSRIs. The answer is B. Cholinesterase inhibitors. For patients with Lewy body dementia, hallucinations and agitation are particularly troublesome. No medication is needed when the symptoms are mild, but acetylcholinesterase inhibitors should usually be tried first in other cases when medication is used. Research indicates that cholinesterase inhibitors, Rivastigmine, may decrease Lewy body dementia related to psychiatric symptoms, especially anxiety, apathy, delusions, and hallucinations. Patients with Lewy body dementia treated with cholinesterase inhibitors have been found to perform better on neuropsychological tests. Atypical neuroleptics are typically used when cholinesterase inhibitors are ineffective. Anti-epileptic drugs lack clinical data to support their use in patients with Lewy body dementia. Although patients with Lewy body dementia often experience depression and may be treated with selective serotonin reuptake inhibitors, it should be noted that SSRIs are not the drug of choice for treating hallucinations and agitation in Lewy body dementia. Question 19. Which of these symptoms is seen in most types of dementia? A. Aggression, B. Numbness and weakness, C. Obsessive compulsive behavior, or D. Olfactory hallucinations? The answer is A. Aggression. Patients with any type of dementia may present with aggression, social withdrawal, changes in behavior, cognitive difficulty, difficulty in communication, difficulty performing tasks, forgetfulness, getting lost in familiar neighborhoods, loss of independence, memory loss, mood changes, self-neglect, personality changes, and vulnerability to infections. Numbness and weakness are signs of stroke, which can cause vascular dementia. Olfactory dysfunction occurs in later stages of Alzheimer's disease, but olfactory hallucinations are not common to all forms of dementia. Obsessive compulsive behavior is primarily associated with Huntington's disease and is considered an atypical dementia symptom. Question 20. According to a recent study, which of these was associated with the biggest reduction in dementia risk? A. Lycopene and vitamin A, B. Vitamin C, C. Lutein and zeaxanthin, or D. Alpha-keratin? The answer is C. Lutein and zeaxanthin. A research study found that lutein and zeaxanthin was associated with reduced risk of all-cause dementia in persons greater than 65 years. There's no association found with vitamin C, lycopene, or alpha-keratin. Alrighty, all done. Good luck on your test. Once you do your test, if there's a question that did help you for your test, comment below and let me know.